Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos published in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others around the internet. In the last episode of Know Your Mind segment, we clarified the nature and symptoms of childhood-onset fluency disorder or stuttering. In this episode, we consider the causes, diagnosis, and treatment of childhood-onset fluency disorder or stuttering. Causes of childhood-onset fluency disorder. The exact causes of childhood-onset fluency disorder are not known, as researchers continue to study the underlying causes of the origin of this disorder. According to them, a combination of risk factors may contribute to its origin and development. Possible causes of stuttering include the following. Firstly, researchers believe that onset and development of disfluencies or impairments of the ability to produce smooth and fluent speech are driven by a set of interactions between linguistic, motor, emotional, and neural factors. Evidence indicate that abnormalities in motor control, such as timing, sensory, and motor coordination, may be involved. Hence, abnormalities in particular regions of the brain can trigger the emergence of stuttering. Secondly, genetic factors can contribute to the development of stuttering, as this disorder runs in families and can result from inherited abnormalities. Thirdly, situations causing distress, such as feeling nervous or being pressured, can cause stuttering and worsen this condition. For instance, speakers who normally do not stutter may experience speech disfluency when they are nervous or feel pressured. Similarly, situations of unwanted stress that comes from high parental expectations or other type of pressure can worsen an existing condition of stuttering. Fourthly, a stroke, traumatic brain injury, or other brain disorders can cause speech that is slow, that has pauses, or that repeats sounds. This anomaly is often referred to neurogenic stuttering. Fifthly, severe speech disfluency can appear after a person experiences a serious emotional trauma. This condition is often referred to as psychogenic stuttering. Sixthly, delayed childhood development can cause stuttering, as children who have developmental delays or other speech problems may be more likely to stutter. Either any of the above mentioned risk factors or a combination of some of them can cause childhood onset fluency disorder. Once affected by stuttering, the person suffering from it can have problems communicating with others, anxiety about speaking in public, the tendency to avoid speaking in situations that require conversing with other people, and difficulties in social interactions, academic activities, or participation in work and success in these areas. Besides, they also can experience low self-esteem and lack confidence to positively move forward in life. Hence, the need to diagnose and treat childhood-onset fluency disorder. Diagnosis of childhood-onset fluency disorder. It is common for children between ages 2 to 5 years to go through periods when they stutter, which is part of learning to speak. It gets better on its own as the child learns to speak normally. However, in some cases, stuttering persists and require right diagnosis and treatment to improve speech fluency. You need to contact a speech language pathologist and make an appointment to begin the diagnosis if the stuttering lasts more than 6 months. If it becomes more frequent or continuous as the child grows older. If it occurs with other speech or language problems. If it occurs with muscle tightening or visibly struggling to speak. If it causes anxiety and emotional problems such as fear or avoidance of situation where speaking is required, and if it begins as an adult. When a child or an adult is brought to the speech language pathologist, he would create a health history of the patient. If the patient is a child, he would get the needed information from the parent, caretaker, or other individuals who may know the child's illness. If the patient is an adult, the speech language pathologist may get the information directly from the patient himself and from his colleagues and relatives. With the information he gathers from the health history of the patient, a speech language pathologist would make a comprehensive evaluation which would help him to identify the specific issues associated with a patient stuttering, create a customized treatment plan, and decide on the best treatment approach for the particular patient. Treatment of childhood-onset fluency disorder. Treatment basically consists in effectively implementing the customized treatment plan made based on the condition of the patient. The treatment may not eliminate stuttering completely. Hence, the focus of treatment is to teach skills to the patient that help to improve speech fluency, to develop effective communication, and to participate fully in school, work, and social activities. Treatment includes both medication and therapy. Though some medications are administered for stuttering, none of them have been found effective solution to the problem. However, speech therapy and cognitive behavioral therapy are used to cultivate natural speech patterns and to resolve stress and anxiety so as to improve self-esteem respectively. The speech language pathologist, either in a one-on-one session or group session, address the issues of developing fluency of speech and building confidence and better self-esteem. He may use specific electronic devices to facilitate and improve fluency. However, parental involvement in participating techniques at home is the key part of helping the child to cope with stuttering. In helping the child, the parents should, firstly, listen attentively to the child by maintaining natural eye contact while speaking. Secondly, wait for the child to say the word he or she is trying to say without jumping in to complete the sentence. Thirdly, set aside time for talking to the child without distractions. For instance, at meal times. Fourthly, speak slowly without being in a hurry, as slow speech may help decrease stuttering. Fifthly, take turns talking and be a good listener. Sixth, don't focus on child's stuttering by not creating a sense of urgency, pressure, a need to rush, or exposing the child to speak in public. Seventh, offer praise rather than criticism. Praise the child for speaking clearly. If you need to correct, do it gently and positively. Eighth, accept the child just as he or she is. Avoid reacting negatively. Instead, support and encourage. A speech language pathologist can guide the parent in doing these important follow-up programs at the home front. Understanding the causes of the type of stuttering you are suffering from, getting diagnosis on time, and following the specific treatment plan suggested for you by the speech language pathologist on a regular basis, you can manage your childhood onset fluency disorder reasonably well. In the next episode, we will begin our analysis of social communication disorder in detail. Thank you for watching this video. Stay blessed until we see you again with another video.